Hello, and thank you for joining us for our Your Behavioral Health Benefits Working. This program is part of the SHRM webcast series. You can learn about upcoming and on-demand events from our e-newsletters and the webcast homepage at shrm.org/webcast. SHRM thanks Unum for sponsoring this program and our series of free webcasts for the HR community. Before we turn things over to our speakers, we want to provide you with some guidance on using the SHRM webcast interface. I want to introduce our panel today. We are going to be hearing from Dr. Matthew Schrock from McLean Hospital and Harvard Medical School, Christian Ranta from Meru Health, and Swapnil Prabha from Unum. Here is some background on our speakers. Swapnil Prabha is Vice President of Digital Offerings at Unum. In this role, she's helped to develop solutions such as Unum Behavioral Health, which addresses the full continuum of mental health for employees from baseline measurement to a complete range of easily accessible resources and therapeutic interventions. She also leads strategic direction and capability priorities for Unum's Leave Logic. Prior to joining the Unum team, Ms. Prabha spent 7 years with McKinsey & Company. Matthew Schrock, Ph.D., is a clinical psychologist with appointments at McLean Hospital and Harvard Medical School. He is the co-director of psychology training for the McLean Hospital Harvard Medical School doctoral internship in clinical psychology, and he is a senior staff psychologist at McLean's Behavioral Health Partial Hospital Program. Dr. Schrock specializes in providing evidence-based treatment in a flexible, personalized manner. Christian Ranta is CEO and founder of Meru Health, an online healthcare provider setting the new standard in mental health care. With Meru Health, Mr. Ranta is on a mission to empower 10 million people suffering from mental health challenges by the year 2027. Prior to founding Meru Health, he co-founded and ran a diabetes technology company, Mendor, which developed glucose monitors and glucose data analytics for improving diabetes care. And in an earlier life, he was the lead guitarist and songwriter for the internationally known heavy metal band Norther. With introductions complete, I'm pleased to turn over the webcast microphone to our first speaker, Swapnil Prabha.
Thank you, Mike. So excited to be here. Checking on my mute button situation there for a second. The plan for our session today is threefold. One, we're going to start out really quickly by hitting why are we here, and clearly we're all here for a reason, which is mental health related, but always good to remind ourselves what are the key statistics, what are our employees and employers feeling. So we'll spend just a little bit of time talking about that. We'll also, each of the speakers will talk about what specific expertise, experience do we bring to today's session. We will then quickly transition over to talking about the top challenges in creating an effective program in behavioral health, and of course, how to overcome those. We will then end our planned portion of the program with just summarizing the discussion and going through some key takeaways before turning over back to SHRM to moderate our Q&A session. So with that, let's jump right into it. So why are we here? We have seen a lot of stats over the last, especially couple of years, and here's some more to add to it, and I felt that these were really compelling statistics to bring to this group. On the left-hand side is some research that Unum has done. On the right-hand side is some research, or study rather, that American Psychological Association did. Both of these are 2021 data sets. On the left-hand side, employees who say they're concerned about their mental health during the pandemic. This was 40% for employees and 55% for millennials. If we had a Gen Z bucket over here, that percentage would be even higher. And that is something important to note because as we think to the future, more and more Gen Zers are entering the workforce, and what we do expect that population to bring is a lot more heightened sense of awareness when it comes to mental health support, and also desire to get more support from their employers. And so that is something to keep in mind as we're thinking about our mental health strategies and solutions going forward. On the right-hand side, some really compelling numbers. Employees who said that they experienced at least some work-related stress in the last month, almost 80%. Stressed out employees who were intending to change jobs over the next year, almost or more than 70%. Obviously, there's some overlap between those two stats, but the thing that most stands out to me here is the financial impact to companies as it presents itself through presenteeism, which is employees are present at work but are not productive, are not engaged, are not able to be so. Absenteeism, which is employees who are in an unplanned way not able to show up to work. And then, of course, turnover, we're all aware of the very real costs associated with that. So really compelling reason for us all to be spending time in trying to address these needs. And then specifically, what brings me to this session is I firmly believe that employers can have a very important role to play in their employees and frankly their families' mental health journey, but only if their strategies and solutions actually work. So I'm really excited to share my experience and expertise in helping employers build mental health forward strategies and solutions. And with that, I'll invite Dr. Matthew Schrock to talk about what brings him here today.
Thanks, Swapnil. Hello, everyone. Very excited to be here today, too. I think this is going to be a really fun webinar today and cover a lot of really cool things. I'm here because McLean has had a major kind of role in battling stigma around mental health. We have a huge mental health stigma campaign called Deconstructing Stigma. If you've been in and out of Logan Airport anytime in the last several years, you may have seen the installation around it. So I'm here to talk about my expertise, my experience in helping companies respond to that stigma by creating an atmosphere of openness and support that will hopefully increase employee access to and utilization of mental health resources. And the larger picture being hopefully have an impact on whole population health. That's particularly important as Swapnil has kind of laid out since the pandemic, where we've seen a huge increase in the need for mental health services to the point that there's a pretty big mismatch in the demand versus what's available. I spoke with somebody just the other day who reached out for some help, and they had contacted 45 different providers in the last 2 weeks to try to get help for their daughter and could not find a single one that was taking patients. So it is a real issue that is really impacting people, and I think that I'm really looking forward to talking about how what we're talking about today can help that issue. Christian?
Thanks a lot. Thanks a lot. Hey, good to be here today. Hello, everyone. Thanks so much for having me. And yeah, why am I here today? So, I mean, Mero Health, I was one of the founders of Mero Health back in 2016. And basically, my personal reason is like having the background in digital health and in healthcare. I've always wanted to build things in healthcare and help kind of to bring about the new innovation and novel solutions to help people. But with mental health, it's more personal because I lost my brother Peter back in the days to depression and suicide, unfortunately. And after I had sold my previous business in 2015, I decided to go into mental health care. And even more specifically, what I believe, there's a huge opportunity to build better, faster access solutions with, kind of giving people access to more holistic care, more mind and body care. So that's why we call at Mero Health we're building the new standard of mental health care, because it's beyond sort of like the current standard. It's more kind of into the mind and body realm and more so like comprehensive and holistic care to addressing some of the sides of the human psyche and the human experience that are not normally addressed so much on the mental health side. So we've seen tremendous results, and I'm really excited to be here today. So hopefully this will be helpful for all of you. Appreciate it.
Thank you, Matt and Christian, for sharing that. And Mike, I believe you will help us with a poll.
Yes, and we do have some polls during the program today. We'll ask you to vote on your screen rather than typing in the answer. And here is the first question. What are the barriers your employees face in getting the mental health care they need? And you can choose more than one answer here, but your choices are stigma around seeking help for mental health issues, knowing how or where to begin seeking help, difficulty accessing quick, convenient care, or cost. So take a moment, think about your organization, make the choices that make sense to you, and we'll give everybody another 10 seconds or so here to make their choices and get them in. We often get asked how many people are participating in our webcast polls. We've got about 500 people logged on for the call. Right now, it looks like about 40% of you have voted. We'll give you another 5 seconds or so to get those votes in. All right, I'm going to go ahead now and advance to the results, share them with our audience and the speaker. It looks like the most common answer, indicated by about 68% of our viewers, is knowing how or where to begin seeking help. Also, more than half of you indicated difficulty accessing quick, convenient care. Stigma around seeking help for mental health issues and costs were also a big concern. Looks like somewhere between 37 and 40% of the audience selected that. I'll turn things over now, back to our panel.
Thank you, Mike. And I'm at least not surprised that there is, even though there are a couple of clear majorities here, but overall it's a pretty even spread. Christian, why don't I invite you to, anything surprising with the results that you see?
Yeah, I mean, like we see a lot of these similar like patterns in the market for sure. So I don't think that it's kind of too surprising, to be honest, but it's it's definitely more sort of like explaining the problem and opening up the problem that we're all facing. So appreciate all the voters kind of chiming in.
Absolutely, and I will say that while all four have equal participation is not surprising, I am a little bit surprised by the small increase there of the knowing how or where to begin seeking help. But the good news is we will certainly talk about that today. So with that, and maybe the poll kind of gave it away, but as we think about top challenges in creating an effective program, there are 4 things that we're going to cover today. That we're going to start with talking about stigma. We will then talk about navigation and personalization. We'll then go on to talk about access and what to do about a very clear challenge there. And then finally, last but not the least, talk about impact and the importance of measuring it and measuring it the right way. So with that, let's get into stigma. Now, McLean Hospital has done a tremendous amount of work in this space. Matt, would love to hear from you. Why should employers care about stigma, and what can they do about it, more importantly, perhaps?
Yes, thank you. I mean, it's a great question. As the poll's going up, my eyes go immediately to that particular answer because that's where we spend a lot of our time. Even after decades and decades of there being a lot of work being done around destigmatizing mental health and trying to make that space more comfortable for people, we still see stigma as one of the major obstacles to people accessing the help that they need, and being comfortable opening up or talking about their mental health struggles. And that's across the board, but it's even more of a difficult situation at work, where you may not know how to communicate, you may not know if it's okay to communicate, and that stigma, both the external, what other people might think, and the internal, what I might think about my own mental health struggles, really being a barrier to moving towards any kind of significant help. There's a lot of interesting stats in terms of how long it takes people to move in the direction of getting that help. NAMI, or the National Alliance of Mental Illness, says that the average time is 11 years. I mean, think about that for a minute. You start to struggle around, say, some anxiety, some depression, and the average time to get appropriate help is 11 years. That's a lot of time to be struggling and suffering with a significant issue, and also a lot of time that could be spent getting help and alleviating some of those issues. It's important to acknowledge that if people in your organization don't feel comfortable seeking help, they don't feel comfortable talking about these issues, then your EAP or other behavioral health benefits are going to go unutilized, and those people aren't going to get the help that they need, right? And if we take on top of that what we were talking about earlier, that there's a significant lack of available help in the community at this moment because of the demand, we can see how much more important it is for them to be able to access these resources through these avenues. Another thing that's really interesting here is an important kind of leaning back to this idea of stigma and access is that a report by the Northeast Group on Health indicated that most companies have a really low utilization of their EAP, around 3 to 5%, which is really low. And should be some cause for concern. How can we increase that access? How can we increase people's willingness to engage? I've had the opportunity to work with Unum over the last several months doing some C-level trainings on creating a different environment, opening that environment up, creating support in the workplace to hopefully increase this access and utilization of care. And it's interesting because there was a report that came out that said most employers actually have acknowledged that there's a really big need for mental health coverage, mental health awareness, use of mental health resources, but less than half of the people that were polled actually had anything in place in terms of an anti-stigma campaign in the last year. And only about a third of the big companies that were polled did any kind of in-house training for managers or employees. So this is a really significant area that we can spend some time with companies and improve the environment in ways that can help. One answer is to do exactly that, is to implement some sort of anti-stigma campaign and really start to work on changing the culture within a company. One way of doing that is to implement, a multimodal, kind of multi-tiered level support structure, so that we're not making any assumptions on what kinds of access or what kinds of needs potential patients have, right? They can enter the system at lots of different areas and have lots of different ways that they can access support. Sometimes it's really overwhelming to think about just going straight in to talk to a therapist or have a one-on-one meeting with a talk therapist. How can we support people and kind of meet them where they are and help grow that sense of agency around accessing these resources, and also, again, changing that culture within the company about how we can and the appropriateness of getting to those resources. There's a couple things that we focus on when we do these trainings too. Really getting the word out there. One of the other things on the poll was people not knowing how to access resources. So it's really important that we spend time educating people about what resources are available and how they can access them. The other thing that's important is training on many levels, not only at the manager level, so managers are more aware of what to look for, how to communicate with employees, how to encourage them to engage with the resources that are available, but also training at the executive level. How do we help executives start to turn that culture around and help employees see the structure at work as a place of support, a place where they're going to be able to get the things that they need to be more productive, rather than bumping into that stigma and being really nervous about acknowledging or talking about or seeking the help that they need. And we can do this, the more standard way too. Emails, posters, talks, ways of engaging mass communication. One of the things that we do here at McLean around, we've been doing a lot of DEI work lately, and one of the things that we do is we have a monthly meeting in the units where everybody gets together and we break into small groups and discuss a particular area of need or interest, just so we have a time that we're setting aside and engaging the conversation in a meaningful way. And of course, support groups, other things that are available at the employee level, so that there's a community around mental health and not just this sense of me by myself trying to access this support. Swapno, Kristen, do you have any additional thoughts or things you wanted to chime in on here?
I think from my perspective, I was just going to add that a lot of what you were saying really resonates, Matt, and I think it's key that the point that you made around starting with the C level is really, really important, because role modeling is really important, and a lot of us look up to our leaders and managers, et cetera. And so the more that we can really cascade that down and up in all ways, really, in all directions, is really important. And I will say, going back to the poll results, it's interesting that stigma was the least popular answer, if you will. However, everything does start from there. So no matter how much you invest in the best solutions, but if there is not that culture of support, it won't really help the company and the results that we want to get out of those mental health support and solutions.
Yeah, I think that's right on target. And I really, actually, Christian, before I hand it back to you, one of the things I love about your intro is that you're modeling this for us by acknowledging how mental health has impacted you personally and your family, which is exactly what Swapnil's talking about, right? You're modeling exactly what we're talking about within this webinar itself.
Yeah, appreciate it. But I mean, like, one thing that kind of stands out for me is that what we've learned over the past few years working with employers is that it's really, really important to kind of really build a good plan for communication. And that includes, email marketing or others like posters, events, virtual events, on-site events, maybe, like text message campaigns, maybe postcards to people's homes. Like, all these things are really important, and especially emails actually work surprisingly well. And it's also a very easy and kind of a cheap way of doing mass communications. And it, again, works surprisingly well. But that's one thing that we've seen, that it's, if not properly planned for and addressed, a lot of the benefits that are offered they don't get properly utilized, and people just don't know about them. So it's a huge kind of an effort to actually plan for all the communications going out for all the people. So.
That's right. That's right. And I like too that we're thinking about it on multiple different levels, because people can engage it in different ways.
Mm-hmm. Which is a perfect segue to navigation, and then we'll shortly talk about personalization in the same similar context as well. When we think about navigation, perhaps not surprising, and it was the most popular choice in the poll, employees simply often don't know where to begin. And we start here, we lay out some questions that are common that we get asked all the time. But even before that, do I even need support? If I have acknowledged finally that, yeah, maybe there's something that I want to do about my mental health challenges, what support do I need? What do I have available as part of what my employer offers? What is the cost associated with those different sort of options that are there? How do I know what's right for me? How do I get started? When can I get started? How quickly can I get started? Do I need to get started right away? There are so many questions that are floating around in any employee's mind. And this is even after they've even maybe acknowledged that, okay, maybe there's something that I need to do about it. So the clear answer, as you've heard, there's obviously, we need to take a more of an omni-channel approach to it, but what we do know is that digital mental health hub type solutions do work. The good news is that majority by far of the employees are comfortable using these types of resources from employer, and we know that these types of digital therapeutic environments do actually work. However, is it good enough to bring a digital solution and call it a day? No. There are some best practices that one must follow, that employers must really think about to create a seamless navigation experience. We really do need to think about this as if you're holding an employee's hand and walking through their mental health journey with them. So I often think about it as one thing that you have to make sure that there is a single front door to all things mental health. So when an employee has or even begins to acknowledge that they might want to do something about their mental health or their family's mental health, there is a single place that they can start. And as they open that door, if you will, and take the first step, there needs to be very, very clear guideposts around what are the different options, where can they go next. And going back a little bit to our conversation around stigma, this navigation, if you will, experience, or this front door, the single digital hub, this needs to reinforce all of those messages that they have already hopefully been hearing about through the communication campaigns, through the training, through word of mouth, et cetera. And so this is not just a way to bring folks in and give them a lot of choices, but it's actually really holding the employee's hand, walking them through the experience, educating and reinforcing around what's in it for them, what's in it for others, how can they show up differently for others. And then a very important piece of it is, how do we create a mechanism for them to tell us a little bit more about them, and then the solution is able to actually provide them with specific recommendations. So this is all about balancing that perception of control that we want to keep with individuals, but removing the burden of choice, if you will. So it's a delicate balance, often sounds even trivial, but it's actually quite difficult to crack in terms of what is the right balance to strike there. But the best digital solution will solve for these things. And most importantly, and where we are getting into our next topic on personalization, is to also recognize that not everybody is made the same. And the digital platform should have the ability to adjust. So if an employee is opening up and if that individual is telling us something about themselves, the platform needs to be able to adjust and curate that experience for them so they do feel that this is their solution, this is their front door that they've gone through, and they can build that trust. And this doesn't stop with just the digital or the platform experience, if you will. It actually also translates into what is the right support or treatment option for different individuals. And I know, Christian, you spend a lot of time thinking about that. So I will invite you to comment on this.
Yeah, thanks a lot, Swapnil. So appreciate it. So first of all, like you already alluded, like there's no one size that fits all. So like people are different, and people have very different backgrounds. Like someone may be having kind of like a high stress work and they've developed anxiety over time because of like chronic stress, or someone may be on a disability leave because of debilitating depression that they've had for years, and finally kind of tipped them over. So there are many different backgrounds where people are coming from. And also, therefore, like the solutions need to also be more customizable. And we need to kind of be able to work with people with different backgrounds in different ways to make it effective for them and make it meaningful, make it something that they wish to engage with. And then people again are also consumers. So some people like they like sort of like more app experiences. Some people want to like talk more, and therefore it's important again to look at this like range and kind of the range of services and make things available for people in where they're coming from. And some again, another perspective would be that like some people, they have that hour every week that they can contribute, and they can maybe do a session once a week. But some people they may not have that time, and they maybe need to do like 10 minutes here, like bite-sized chunks, 15 minutes there, maybe lunch break, and then maybe in the morning something, but they're too busy to like schedule like a session for every week. So those are like some perspectives. And then, one thing that is really important is that when there's there's obviously a way where people can use just like self-help things, digital solutions, educational materials, like different practices, different things like that can be administered without direct involvement from a provider. But then there's also a lot of cases like more severe mental health challenges and things like that, where a provider is going to be really important and an essential part of the care continuum. And in that case, it's also important to understand that people resonate better with providers that they can relate to or relate with. So that's another thing that's kind of really important in mental health in general, to find that good fit between the participant or the patient and the provider of care to make it really like work well. But these are like some points. But before moving forward, like would love to hear from you, Matt. Like, what are you seeing out there from your perspective?
I think this is right on target. I mean, the way we kind of talk about it, the kind of one size not fitting all. We use the term meeting somebody where they're at, right? Where we can't expect everyone to show up at the same place, at the same level of readiness, at the same understanding of how to engage services. And so providing a myriad of different options, I think, is really important and helps, I think, increase people's comfort. And as I was already kind of alluding to earlier, helps with some of that stigma we were talking about. But I also think that this last point you're making around fit of provider is huge. This is something we see a lot in my world, where you can refer somebody on to an extremely competent, extremely well-trained provider, but there's not a good fit in terms of the two kind of personalities or the two people. And so they just don't work as well, right? And so paying some attention into where those referrals are coming from, having some information ahead of time, understanding that there could be a process of finding the right person, and having somebody being able to help you make that connection, I think is really important. And could be a huge resource to people.
Appreciate it. Okay, so moving on to the next one. So what are then like some keys to a more personalized approach? So first of all, like kind of coming back to the sort of like multimodal approach. So I think that's really important. What we've learned is that, again, people have different needs and I'll give you an example. Like sometimes someone may have depression, and then they also have sleep difficulties, and they may have like severe insomnia and depression. And it's like if you only work, say, with like talk therapy, workout, so like the depression side of things, that's definitely very beneficial and very much needed. But it may still not address or solve the sleep issues. And then if people are, if that doesn't get addressed, it's really hard to actually recover from depression if you're not sleeping at all. So that's just one example of like why these different perspectives are needed to help people like heal and get better and stay better in the long term, so that they don't kind of relapse again. We only kind of address their depression, but then not the sleep side of things. And then, they're not sleeping and they're overly stressed. And then in like 6 months, 12 months, they relapse again to have another depressive episode. So that's why kind of this the multimodal approach is so important. And then also another perspective is that like kind of finding out what the individual needs, like really listening and really kind of collecting enough information to understand how to customize the offering to the individual. That's really important. So kind of like developing a personalized care plan, and then kind of working towards the goals that the person has set for themselves and that the provider has also like kind of they collectively set for this this initiative or this intervention to be tackled. So those are like kind of very important points. And again, give you an example. One of the patients that we work with, like she was on disability, and then she wanted to kind of get back to work. She had been on disability for quite a while, and she was really struggling. She wanted to get back to work, and she also like didn't feel like she could connect with her children or with her family members anymore too well, because she had so much brain fog and kind of was disabled in that sense. And those were kind of like some of her goals, like in addition to the clinical goals of like, hey, I really want to connect with my kids again. I really want to like connect with my spouse. So like kind of keeping those things, in there while we're working on some of the clinical aspects is really important, because that's kind of a strong motivator for someone to like have that extra pull to get back from, or like kind of really, be empowered to come back from some of those states that can be pretty challenging for people. And then another thing, I guess, that's also very important is the care referrals. So very often people may have like, there's maybe a PCP, a primary care doctor that's in the loop, and they may be working on some other condition that the person may have, say like diabetes, and then the person may have, diabetes and depression. And then again, it's really important that the care team or, different providers work in unison and can communicate and kind of support the patient so that things are not siloed. And that's where like care referrals are so important. And if there's maybe sometimes like higher levels of care needed, like some more severe, like maybe even like psychosis or something that may happen sometimes, rare but still happens, and then that would need like a a care referral to other resources or maybe even inpatient care for that person. And then finally, I think we kind of touched upon this already, but what's really important is that there's obviously like diverse populations amongst the different employers and different populations out there. So it's also important to match these diverse populations with diverse providers, because people, again, like connect much better with other people, other providers that they can relate with and that they can trust. And then again, that they find that's like jive with, like Matthew talked about the fit that someone feels that, hey, I kind of get along with this person really well. So those are really important points. And if they're not properly addressed, they can hinder access to care for a lot of people. So those are like some things I think are very important. And yeah, anything else you want to add, Matt or Swapnil?
Well, the other thing that strikes me about this is not only the multimodal nature of it, but the potential bidirectional nature of it, right? That we can have somebody enter into the care kind of continuum, right? And maybe they're starting off at a very kind of like entry level. I'm going to do some kind of self-helpy kinds of things that are generated on this particular platform, and I'm going to do some reading, I'm going to do some exercises, I'm going to learn some basic skills. And having exposure to that opens them up in a different way to then maybe accessing different levels of care if and when it's appropriate, right? And then the other way around too. Oftentimes I find in my practice with individuals that like I may be working on a particular clinical issue, like you were saying, like the depression, which is really impairing, but there's a sleep issue, right? And the sleep issue needs to be addressed, but I may not have enough time in a 1 hour weekly session to prioritize that with some of the other stuff that we're focusing on. So being able to then refer back the other way and say, hey, there's this online resource, it's really great. Go in, watch this particular thing, and it's going to tell you a little bit about the sleep issue. It's going to recommend some skills. It's going to give you a lot of information. And then once you watch that, come back in and we can talk about it a little bit and see what might work best for you. So it's really nice to be able to have that kind of bidirectional flow of information as well.
Yeah, thanks, appreciate it. Really good points. Anything from you, Swapnil?
Just totally agreeing with everything that I'm hearing, and the only thing that I would add is that we often talk to employers about how we need to think about investing in 100% of the employee population mental health and not just the 10, 15, 20%. And so that's where personalized pathways, multimodal, all of this makes so much sense, because there will be a majority of the employees, they need more of the maintenance and making sure that when they do have those stressful triggers or something happens in their life, they have somewhere to go to for support and getting the right level. And then, to both your points, that there is potential if things get worse or better both ways, but the solution is kind of giving them that warm hug, if you will, across all of their needs and all of the employees' needs. And it's hard to figure out how you can get all of that in one, but that's where I also do think collaborations become important, across different experts. Like, I'm excited to be here with the two of you today, just as an example, that those become important to solve this as a society, really.
Yeah, thanks a lot, Swapnil. For the next piece, Mike, can you please grab the poll?
Yes, we have another opportunity for our audience to weigh in with their thoughts on this question. What do you think is the national average wait time for behavioral health services? So there is an answer, and kind of what does your experience or intuition tell you? 14 days, 20 days, 35 days, 48 days, or 60 days? So if you can go ahead and weigh in with what you believe the answer is, we'll give everybody a few seconds here to vote with their responses. Great, we're seeing those votes come in. We've got about a third of the audience that has voted already. I'll give everybody about 10 more seconds here to get those votes in. Great, and with about 60% of the audience now having weighed in, I'm going to go ahead and move us to the results so far. Looks like the leading candidate here is 35 days, with about 36% of our audience indicating that. Split pretty evenly with other folks who are saying 60 days, 48 days, 20 days. Not that many people, fewer than 10% of our viewers, think 14 days is the answer. I'll turn again back over to our speakers.
Thanks a lot, Mike. Yeah, these are interesting figures, interesting data. But what we know is that it's actually 48 days. So it takes 48 days on average to get access to care, and it sounds unbelievable, but that's the reality, and that's even like kind of a fairly good case. And I'll walk you through an example of a care journey of an imaginary person here called Sarah. So, Sarah's working. She's an employee at a company, and basically she's realizing that she has a need for some behavioral health services, and she's now asking for some resources from a mental health access program, or there's a program that the employer offers, and she basically gets a list of providers, and there's, say, 30 to 50 names with phone numbers, maybe with email addresses for all these providers. But there's, first of all, there's no quality information. She has no idea, by looking at all these providers, how good are they? Are they actually is this person here a good provider, or how is the person rated or not rated, or what kind of modalities does the person practice? What are the credentials? All these things are kind of escaping her, just not included in that list. And then, but she starts calling, she starts emailing these people, and she goes through tens and tens of people, and then that obviously takes a long time. But she learns that pretty much no one's accepting new patients. And we kind of heard this example earlier in this presentation about this kind of crazy number of people or providers that you need to go through to find help for yourself or for your child in that example. So, she kind of then finally gets someone to reply and says that, hey, I've got availability, but that's like three weeks out. And she's like, but I'm struggling now. Like, this is like the worst week maybe of my life. Like, I'm maybe in the middle of like a really bad depressive episode, or just like super anxious, and like I can't get any help. Like, it's 3 weeks out. So then she decides to like try any out of network benefits. Like, maybe there's someone I can find out of network. But again, even in that realm, there's significant wait times. There's significant shortage of providers, and then again the costs can be out of control there. So unfortunately, like, she eventually gives up because she can't find the right kind of a match for her, like more urgent need. So this is just an example of like what it can look like very often. And I mean, Matt, maybe do you want to kind of chime in? I think you've also seen like a lot of so like even different extremes of this version out there.
Yeah, I think this is actually one of the least severe cases. I mean, I can say that, for instance, at McLean, where I'm working in the particular unit that I work, which is a general psychiatry day program, we have a minimum of a 3-week wait to get into our program. And this is for somebody stepping up to a more significant level of care. So this isn't even somebody that is, trying to access outpatient level of care to get some more support. This is somebody that's trying to avoid getting, inpatient level of care because the presentation and the difficulties they're having are so severe. So we're talking about a 3-week wait for that. We have a significant amount of trouble actually locating providers for people that are leaving our program. And we've actually had to implement a policy recently that if they're coming into our program to get support at the partial level of care, they need to have existing providers. Because if they don't have providers coming in, we've had such a difficult time finding people to take on new clients that we can't discharge somebody without having care in place, right? And so that creates a really a difficult ethical bind, right, for the levels of care and transitioning back and forth. And I would say too that this kind of weight and lack of resources exists at the out-of-network level too. Many of the providers in this area that I'm in are out-of-network providers, and the weights and the availability are the same. So you're not even getting that much benefit from moving into an out-of-network model in terms of availability. And then I'll say lastly, this doesn't even take into consideration all the things that we were talking about earlier about training, fit, all these things. You're basically just blindly calling somebody. You don't have any idea what their training or background is, if they're engaging in appropriate care for the thing that you're seeking treatment for, and you don't have any choice around fit. Do I get along with this person? Am I feeling comfortable? Can I engage in treatment in an appropriate way with this person? None of that is considered within this experience. So it's I think it's a really difficult, very dire situation for a lot of people, and can get very frustrating.
Yeah, appreciate it. Thanks, Matt. Yeah, so then maybe like kind of moving on to some more positive news here. So how can then like this blend of digital and kind of personal human supported services or provider supported digital services, how can they then work, and why are they potentially a great thing that can be offered these days with all the cool advancements in technology as well? So first of all, like we've talked about here earlier, there's a possibility now to provide immediate assistance for people. Like you can get help the same day you want help. Basically, it can start from like self-help materials, from like different kind of practices. Maybe you can learn like a breathing technique immediately to tackle your anxiety attacks that you're having just now, or you can just kind of like even get some reading material or like some video material for like talking about some restructuring of thoughts that may be harmful, just to get you started so that you can get access to something. And then again, while there's a possibility of connecting you with a provider like really quickly, and that again then, excuse me, sorry about it. It's just a glitch here. So then again, while kind of we're able to provide, with technology's help, we're able to kind of provide people with instant access to care, and also like collect data from people on what are they needing and what level of care are they needing. So that can then allow kind of more precise matching of therapists and providers with people with different levels of need. And then that means that there's more capacity and time for the providers that are out there to actually be working on like the meaningful issues. I'll give you an example practically. If someone's suffering from suicidal ideation and someone else is not, then we should be able to work really fast with the person who's like struggling more, and maybe someone with more mild anxiety or more like mild depression can get started well with some self-help tools and doesn't need like immediately like so quick provider support or higher level of care support. So that's kind of an example what now this technology allows and these platforms allow for more so like individualized care. And then again, there's also a couple other points that are important here. So it's much easier with these tools now to be able to use kind of like an evidence-based framework for everyone. Because again, coming back to the list that we talked about on the previous slide, you don't even know if like someone's trained in which modality of CBT or DBT or other so like psychotherapeutic modalities, and you surely don't know if someone's good or bad at it, because that information isn't there, and it's normally not even collected in networks of providers. But now what happens here is that actually every provider is monitored also on the quality side, and what are their credentials and what are they specialized in. And these things can be now taken into account when matching people with different providers with different backgrounds and credentials, and just good quality control. And also all the self-help materials can all be disseminated in a kind of a standardized way for everyone. So that's immensely helpful already, tackling some of these issues. And then, that kind of, we talked about that kind of blend of human touch, like more acute human touch, like face-to-face calls, audio calls or chat support, or then just these self-help resources, depending on the need of the person. And then finally, one thing is also really important. A lot of the communication happens via email these days. Like still, unfortunately, a lot of like emails going back and forth with with protected health information, with basically patients' health information, and that's obviously not okay at all. But with these digital platforms, digital tools, all the information exchange between the provider and the patient or the participant is secured, and it's not in the open internet by any means. So it's going to stay secure, stays private. So that's also like a huge thing to remember. Some of the benefits with these platforms. So yeah, next I think there's another poll coming up. So Mike, please.
Yes, our third and final question for our audience, and we are asking you this time to indicate what utilization and impact measures your organization's behavioral health approach provides. So you can see the choices here. You can choose among utilization, clinical program effectiveness, impact on productivity, or maybe none of those, or maybe you don't even have a behavioral health program in place. This is one of those polls where you can select multiple options, so please do select all that apply. We recognize that may make it a little bit more lengthy in voting, but if you could hurry those votes in, we are coming up on the top of the hour here, so we do want to have a chance to get in a couple of questions as well. Great, we've seen about a third of the audience vote already, so I'm going to give us about 10 more seconds here for folks to get in their votes. All right, let's get this snapshot of where we stand now with about 58% of our audience having voted. We do have about 35% that say they don't have a behavioral health program in place, and about 20% who chose the none option. As far as those who chose impact and utilization measures, utilization was selected by about 42% of our viewers. 15% selected clinical program effectiveness, and about 10% selected the impact on productivity option. Again, I'll turn it back to our speakers.
So maybe in the interest of time, and I know we want to get to at least a couple of questions at the end, I will jump right to it and talk about impact. The results are not surprising, and we'll talk through those as we go through a little bit of the plan material here. This one always surprised me, but then again not, and given our poll results, perhaps it's not that surprising that only 20% large companies are actually using the clinically validated methods to assess behavioral health program effectiveness. This is unfortunately quite, or it is unfortunate, I suppose, given if you think about where we are today and the need to invest in mental health support is more than ever before, that usually comes with needing to increase investments in mental health. And so if we are in a world where it's really hard for us as employers to be able to measure measure impact of that investment, it's really tough to then make the business case and say, okay, so it's a little bit of a vicious cycle that we are stuck in. And it becomes then really important that we do follow a disciplined approach to how are we actually going to measure impact. So the three things that we often talk about are baselining. It's quite important to understand where we are starting from, and baselining not just one number, but hopefully a granular sense of where our employee population is when it comes to mental health challenges and how is it affecting them both at work and at home. And of course, we always want to preserve privacy and security, but as granular as we can get to get a solid sense of that baseline is important. Transparency around and making sure we are actually tracking the right KPIs, again, at the right levels of granularity while preserving confidentiality and security. Not surprisingly, utilization was something that was very popular that most people get. However, it is important not to just get a single number for utilization, but also to the extent we can actually have details behind it, it's helpful so we can inform our strategy. So just a quick example, if we see that we have multiple geographies as an employer, and if a particular geography is seeing better utilization than others, that could indicate either opportunities to share best practices across those sites, or it could be explained by an underlying cultural difference across the geographies, and then you might want to think about your anti-stigma campaigns differently and how do you actually execute on that. So all of these are not just important just so we know whether the program is working or not, but they can actually help you make different choices as you are thinking about rolling out behavioral health solutions and strategies and communication campaigns differently. Clinical improvement, not all solutions provide that. Once that do, it is quite impressive to be able to actually see the outcome and the improvement that the employees are seeing and the progress that they're making, and that directly then translates into productivity gains, healthcare disability claim cost improvements. And the last one there is probably the one that's most recognized by most folks. The productivity gains I would highlight as a pretty large bucket. It's very hard to prove causality. However, if baselining is done well, it is actually possible to be able to track how is the productivity improving while using an effective mental health strategy and solutions in our employee population. I can't highlight enough that confidentiality security always is extremely important and top of mind, as always. So with that, I will wrap the plan portion up with some key takeaways. And it seems like I'm not able to move the slides, so I might need some help here to just go to the key takeaways. But essentially, the key takeaways are, A, stigma is really important. It needs to be addressed. Second, we need to be able to provide appropriate and guided navigation to our employee population, to individuals that is personalized. Third, access. It's really important. There's still a lot of bias as I talk to prospects and clients. There's a lot of bias still in the world around in-person care, on-demand talk therapy care. It's really important that we to be innovative about it and think holistically from an entire employee population perspective, and think about how do we really work with a solution that can optimize the match, if you will, of the demand and supply to the best possible. So most people are getting the help that is right for them. And then, last but not the least, impact. It's really important to measure the actual impact of what we are investing in, and so we can continue to make this. And also, it's the employee engagement and the employee satisfaction portion of the impact does not need to be in conflict with the business impact. In fact, they go hand in hand. So recognizing that and demanding from our solutions that we work with the right level of KPIs is really important to continue to make that connection for ourselves and for our CFOs, CEOs, et cetera, so we can continue to invest in this. So with that, Mike, over to you for any questions.
Thank you. We will try to squeeze in a question or two in just a moment. Today's program is sponsored by Unum. Unum is a leading provider of employee benefits that has, for over 170 years, millions of people protect their families, their finances, and their future. Unum delivers better ways to access disability, life, accident, critical illness, dental, and vision benefits through the workplace. Unum's award-winning leave and absence solutions help employers streamline absence management while making it easy and engaging for employees to plan leaves, receive benefits, and return to work smoothly. For more information, visit unum.com. But let's see if we can get a couple questions in here before our program wraps up. Viewer asked, does the digital approach for mental health even work? I've heard that talk therapy works far better.
Can I maybe take that?
Please.
Yeah, thanks. So maybe just to summarize at least what we've done a lot of scientific research with Harvard and with Stanford universities and with other universities, and we've done a lot of peer-reviewed, top-notch scientific publications with these universities, showing that this blend of digital and in-person or kind of remote person support actually works at least, if not even better than normal talk therapy. It may sound surprising, but that is what the latest science says, that it actually works extremely well because it's the ability to meet people where they're at and people with different levels of severity and so forth. So that's actually what the latest science says, that these supported solutions, digitally enhanced solutions, can work even better than traditional talk therapy.
And unfortunately, this will have to be our last question, but several folks have asked it, and I think your answers will be illuminating. What can companies do on a limited budget?
What's the question, Mike? What can companies do on a limited budget?
Yes.
Okay, perfect. Yeah. Well, I mean, a lot of the things that we talked about today, I think are applicable for regardless of what we're doing. And I would go back to the beginning of the conversation around stigma and creating that supportive culture. And even with whatever investments we have made in solutions today, how can we maximize the utilization of those solutions? How can we maximize the impact, if you will, that we get out of those solutions? And I would highlight that really working with those solution partners to get transparency around what is being used, what could we do differently, how do you actually, again, drive that engagement is really critical and important. And I understand that with limited budgets, there's different models out there that may not always be supported, but to the extent that we can create anti-stigma campaigns, have a robust sort of supportive culture in the workplace, have a front door, not listing a bunch of things on the internet without appropriate guidance, et cetera, but have a front door to the solution that can then even take folks to existing solutions. Even that is a good start. So I know we are out of time, but if I'll invite my fellow speakers to chime in. Otherwise, back over to you, Mike.
All right, I'm going to jump in here and wrap up the webcast. We are coming, unfortunately, to the end of our hour. We will need to close the program window in about 60 seconds. Closes, an evaluation form will pop up. We hope you'll fill that out. It helps us assess this event and plan for future webcasts. Before we sign off, we want to thank Dr. Matthew Schrock from McLean Hospital and Harvard Medical School, Christian Ranta from Meru Health, and Swapnil Prabha from Unum for the insights and information they shared today. And we want to thank you for tuning in and for choosing SHRM for HR webcast. That concludes this program.